husbands and wives. It's a more common problem in the United States and everywhere else, but it's a huge problem in the United States. More common than most health concerns. It's blood pressures are screened all the time. Every time you go to the doctor, you get your blood pressure taken, and there's a lot more violence going on than blood pressure problems. And even though that is a fact, very few physicians and nurses do conduct screenings for it. And I'm going to read this off here. The Center for Disease Control and Prevention defines intimate partner violence as actual or threatened physical or sexual violence or psychological and emotional abuse directed towards a spouse, an ex-spouse, a current or former boyfriend or girlfriend, a current or former dating partner. Intimate partner violence includes 4 types of behavior. It includes emotional abuse, physical abuse, sexual abuse, and threats. In the majority of cases, it often begins with emotional and then progresses to sexual or physical. And that is from the U.S. Department of Health and Human Services. Okay. And up until 1984, physical domestic abuse was illegal. It was okay for a man to beat his wife as long as the weapon he used. Okay. 1984, or I'm sorry, 1824. 1924. He was allowed to beat his wife with any reasonable instrument. And they then changed that in the 1900s to an instrument no larger than that man's thumb. In 1970, with the women's movement, it brought to the public eye the seriousness of the violence, not only between a man and a woman, but woman on woman, friend on friend, just everyone is apparently beat up. That being brought to their attention, it came out that it's just not in the families anymore. Friends, it's boyfriends, it's girlfriends, it's even in teenagers, and a lot of parents don't want to recognize that their kids in an abusive relationship because their kids hide it from them. For that reason, the biggest problem is kids reporting it to their parents because no one wants to tell their parent that they're being abused, and heterosexuals are the most common to report it. Homosexuals are not, especially men in gay relationships, because in several states it's against the law to perform sodomy. So they have to confess to breaking the law in order to report the violence that they're being inflicted on. So when screening for them, nurses are usually the first line of defense because you're the first person to see the patient for the doctor. You're assessing them, and you need to be performing that screening then. You play a vital role in these clients because you need to provide them with assistance and advocate for them. An appropriate nursing diagnosis for a patient who's being abused is obviously risk for injury. A few things you want to do, obviously, is establish a trusting relationship with your clients. You want to interview them in a private and safe area, somewhere where they're comfortable and they know that they're safe, somewhere where the doors are not open and closing or you can't hear conversations outside. If there's any physical assessments, like rape kits or anything being photographed, especially because those can be very humiliating for a woman to take her clothes off and have her body photographed, and a man, be there with them because they need to know that you are there to support them and to help them. You want to encourage them to discuss the incident. They need to talk about it, almost like ventilating it makes you feel better, to get it out. You also like to, at this time, obtain a history of the abuse. Was it just this person? Has it happened before? Has it been previous relationships? Are you using children? Anything like that. Another diagnosis you could use for a patient suffering from abuse would be ineffective coping. And for this, you want to provide intense crisis counseling for them. You want to encourage them to express their feelings. You would like to accept and acknowledge their state of confusion, let them know it's okay to not understand, but you're here and we're going to work through this. We're going to get you better. We're going to figure out a way for everything to start moving in the right direction. The first step is for you to come to me and let's get through this together. You want to help them identify their strengths and make them not feel like such a victim. A lot of these patients are very dependent and they use their dependency as like a crutch. So, financial. A lot of wives don't want to leave their husbands because you don't want to do that to your child, even though you're putting yourself in harm and the child, because a lot of abusers get jealous of children and beat them too. You want to reestablish their feeling of control, make them, empower them, make them feel better about themselves. Because another diagnosis you could use would be powerlessness related to their lifestyle helplessness. And often they will start verbalizing this after becoming more comfortable with you. You want them to verbalize their fears, especially of them and their child, if there's a child involved, if not just for themselves. As a nurse, you want to help build their self-esteem and never impose your own decision on the patient saying, you need to leave this person now. If they come to you and say, I want to leave him or I want to leave her, will you help me? You need to support whatever decision they decide to make. By telling them to leave that person, you could potentially put your patient in greater danger and anyone else in their family. Teaching is going to be the most beneficial for the client who's decided to leave their partner. You need to involve social workers, local shelters, even emergency rooms if it's necessary. It comes down to that. They need to be aware of where they can go and network. When helping the client to develop a safety plan, you would like to remember to tell them to have like a small bag put aside with a few pieces of clothing for them, their child, if the child's involved, non-perishable foods, grab marriage certificates, birth certificates, checkbooks, bank account numbers. Any court orders. A lot of people have restraining orders against the perpetrator. You want them to have that with them, obviously, in case anything else happens. Have the client discuss with neighbors, like that live around them, signs of distress, leaving the porch light on during the daytime, flashing on and off, putting a piece of red paper in the window when he wasn't looking, so they know, call 911 if you see this, because I can't. Get them numbers, help them out to get local shelter numbers, domestic abuse lines, help like homes, like that women's clinic we went to, domestic abuse clinics. There's so many places you could go. And the first thing you should really remember as a nurse that is helping a patient being used is to assess yourself and figure out your own issues and demons or feelings towards this and how you feel about domestic violence or abuse. You want to identify the stereotypes that you have towards it and just let them go because you're there for the patient. It helps you talk to your fellow coworkers about it just to get it out and say, okay, feel better now. And you don't want to ever impose your beliefs on that patient or anyone in their family because it's not your opinion that counts, you're helping them. It's essential to provide proper and supportive nursing care because it's going to be a devastating time and the scariest time in this person's life because a lot of these patients have very, very low self-esteem. And that's it.